Hi, I'm Marcy from the Brain and Spinal Cord Injury Center at brainandspinalcord.org. Today I'll be bringing you some basic facts on traumatic brain injury. Be sure to check our website for all relevant links and a recap of this article. The time following a traumatic brain injury is both physically and emotionally difficult, as the patient and his or her family struggle to make sense of what has happened and think about what the future holds. Many questions are raised. It's helpful if both the survivor and his family have some general information about traumatic brain injury. It's not uncommon for survivors of traumatic brain injury to feel completely alone, but what many survivors don't realize is that approximately 1.4 million Americans sustain a traumatic brain injury each year. Of these, 1.1 million are treated and released from the emergency room, 235,000 are hospitalized, and 50,000 die. Falls are the leading cause of traumatic brain injury. Those who suffer from a brain injury as a result of a fall are commonly under the age of 4 or over the age of 75. Other common causes of traumatic brain injury are motor vehicle traffic accidents, being struck by or struck against a moving or stationary object, and assaults and other physical violence. While motor vehicle traffic accidents are the second leading cause of traumatic brain injury, they are the cause most likely to result in hospitalization. How do you know if you've suffered from a traumatic brain injury? Well, the signs can be obvious or they can be subtle. In some cases, symptoms of a traumatic brain injury may not be evident for weeks or even months following the injury. However, the most common signs of traumatic brain injury are headaches and neck pain, difficulty remembering or concentrating, issues with thinking, speaking, acting, or reading, fatigue, lack of energy and decreased motivation, changes in sleep patterns, dizziness or lightheadedness, nausea and vomiting, blurred vision, increased sensitivity to noise, lights, or distractions, loss of the senses such as smell or taste. Survivors of traumatic brain injury frequently have lots of questions regarding the long-term outcome of their injury. According to the Center for Disease Control, about 5.3% of Americans, that's 2% of the U.S. population, need help performing everyday activities as a result of the traumatic brain injury. Traumatic brain injury can also cause issues that affect thinking, emotions, sensation, and language. And in some cases, traumatic brain injury can cause epilepsy, which increases the risk for age-related brain disorders such as Alzheimer's disease and Parkinson's disease. This concludes our segment on basic facts about traumatic brain injury. Remember to check our website for the most up-to-date information, including resources and tips regarding brain and spinal cord injuries. Thanks so much for watching.